everyone. Thank you so much for joining us today. I would just like to remind everyone that on this panel discussion, there will be a Q&A feature at the end of the program. So if you have any questions, please make sure to direct them to the Q&A feature of the Zoom chat. So thank you very much. Wendy, you want to kick us off?
Wonderful. Thank you. Thank you, Kay. And welcome, everyone. My name is Wendy Long. I'm the Director of Member Relations and Business Development at the Morris County Chamber of Commerce. And I'd like to take a moment to congratulate our President and CEO, Megan Hunter, who was recently recognized by ROI New Jersey as a top women in business influencer in the associations and organizations category. Really long overdue for Megan to get some recognition in this county. So we were really thrilled to see her get that award on behalf of the Chamber and the Morris County Economic Development Corporation. So we at the Chamber, we're here to connect, collaborate, advocate for all our members on behalf of all our members. And now we do it virtually. Looking forward to going back to some type of a hybrid. So we've been doing virtual since March 16th of 2020, which coincidentally was my start date here at the Chamber. So I have yet to meet Kay in person. So I look forward to that. So this webinar is the second webinar in a 6-part series we're calling Perspectives on Senior Living. This is a very important topic to all of us. We're vaccinated, now what? I want to take a moment and thank our silver sponsors, Care One, Skilled Nursing and Assisted Living, Home Well Care Services, providing in-home care, and Arbor Terrace Assisted Living in Morris Plains. We have 2 gold sponsors we'll hear from. First up is Regina Spielberg. She's a partner at Skank, Price, Smith & King. Take it away, Regina.
Thanks, Wendy. And I'm very glad we were able to sponsor this event and the coming events that you're going to be having on senior living. Skank, Price, Smith & King is a full-service law firm based in Florham Park, and we're a longtime member of the Morris County Chamber of Commerce. We are proud that, like the Chamber, we've been around for more than 100 years. We've been servicing and representing individuals, businesses, nonprofits like yourselves, and public entities too. We represent, we believe, with excellence and integrity. I am one of the members of the Elder Law Practice Group. I will tell you that I recently had somebody contact me and say, "Are you an elderly attorney?" We prefer to think of ourselves as elder law attorneys, and I'm certified as an elder law attorney by the ABA approved National Elder Law Foundation. In our elder law practice, we protect the legal rights and financial resources of and advocate for seniors and people with disabilities, as well as the families that provide care for them. We also advise clients in connection with planning for illness, aging, disability, incapacity, and we do this through planning vehicles such as powers of attorney, for appointing agents for financial matters, advanced healthcare directives, which our doctors are very familiar with. That is naming people who can make medical decisions. We do wills, we do trusts, revocable, irrevocable, anything that's appropriate to our clients' needs. And if our clients do not have capacity, we can bring an action for guardianship if they don't have planning documents in place. And that guardianship can provide the families with the legal authority they need to handle the financial matters, pay the bills, and make medical decisions on behalf of an incapacitated senior. We know that our clients come to us at very difficult times. We try to provide them with sensitive and caring advice, support, and guidance at these difficult times. We help families plan for the costs of long-term care. And when seniors can no longer pay for the cost of long-term care, we help families prepare Medicaid applications to pay for the care. And we we'd like to know that we do provide this services. We have a broad spectrum of attorneys in this area, nationally recognized in many areas, and we invite clients to look at our website to see the work that we do, and hopefully we'll be able to help people on this webinar in the future. Thank you, Wendy.
Wonderful. Thank you so much, Regina. We really appreciate your sponsorship as well as your Morris Business Cabinet membership. I neglected to mention that previously. And our next gold sponsor, Booten Care Center, they are also a Morris Business Cabinet member. Sarah is the administrator there, and we're going to give Sarah the floor for a few minutes. Thank you, Sarah.
Thank you, Wendy, and thank you all. My name is Sarah. I am the new administrator here at Booten Care Center, and it is my privilege and honor to be sponsoring such a distinguished panel. Many I've known for a long period of time, and I call them leaders in the community in their knowledge bases, and have helped us, especially in 2020, gather as much information for survival and care and treatment. Here at Booten Care Center, this facility has over 11 acres of property and has become a second home to all staff and residents that walk through these doors. We're excited for 2021 as under new ownership, we are going through some renovations. We were ready for those renovations in 2020, but unfortunately we had to put stuff aside and take care of the residents and the families. So we're looking forward to these renovations and helping the community celebrate and invite all of the community in when these grand renovations are done. Booten Care Center has a 117-bed facility that has been here since 1942. And it is in the heart off of Powerville Road of Booten. It services beginning to end of life for all residents, subacute, long-term care, palliative care, and hospice. Many of the staff call Booten their second home and have been here for 14, 15, 25 years because it is family and they take care of one another. And my goal and my mission here, which has only been a very short time, is to distinguishly and focus on continuing that aspect of it. We look at Morris County as our community, not just Booten, and want to service and work with whoever needs our care. We want to make sure that we're the answer to their needs, and if we can't, we want to be there to help them. My goal has always been communication and support. If we can't help, we'll figure it out. And the team I have put together here, that is their motto as well, is to help support, even if we can't do it within our walls, building the walls around us through Booten, through Morris County, to make sure that our communities feel supportive and feel needed. Over the 20 years I've been an administrator, it definitely says a lot about why healthcare is so important after everything that we went through. And family and healthcare now, in my mind and in the mind of many of my managers, goes hand in hand. So we welcome any family members, all family members, as we move through 2021 and opening our doors very, very soon, which we're excited to do, and welcoming your families however we can. So Wendy, I thank you for this honor. To the panel, thank you for all that you did. For all healthcare professionals, thank you. And I look forward to speaking with all of you.
Wonderful. Thank you, Sarah. And way back when I was in high school, I got my certified nurse's aide, and that location was where I worked. So it's near and dear. It used to be Tally Ho, Sarah Francis. So it has some history for me. So thank you. Thank you to both of our gold sponsors and our silver sponsors, of course. So I want to take a moment to introduce Trish Colucci. Trish Colucci Barbosa. I'll get your name right one of these days, Trish. She's a registered nurse and president of Peace Aging Care Experts, a geriatric care management firm that provides caring support and skilled guidance to families and professionals as they navigate the choppy waters of the aging process in senior care. And we know those waters can be very choppy. Trish is a past president of the New Jersey chapter of Aging Life Care Association, as well as a recent veteran of its National Board of Directors. I just want you to take note of Aging Life Care Association. It's a very good association to be familiar with because it's national, it's across the country. So I've recommended, a friend in California. She was able to find a geriatric care manager in California to help her with her dad, long distance. So Aging Life Care Association. So kind of put that on a little note. So thank you, Trish, for moderating. I've known Trish for probably a good 10 years now. I have just so much trust and respect for what you do and what you bring to the table and your knowledge. I really look forward to this panel discussion. Thank you to the whole panel. And Trish, take it away. I know you're going to introduce our distinguished panel. Thank you so much.
Great. And thanks, Wendy. Thanks for the intro. It's my pleasure to moderate today's event. And I'd like to take a moment now to introduce our three esteemed panelists. First up is Dr. Stephen Williams. Dr. Williams is a medical doctor who specializes in infectious disease. He is co-director of the Morristown Tuberculosis Center. He's a wound specialist and a wound treatment innovator, and is the infectious disease specialist consultant for Care One facilities. Also participating on today's panel is Dr. Edward McManus, also a medical doctor. Dr. McManus is the medical director of infectious disease at St. Clair's Health System. He was a leader of the COVID-19 task force for St. Clair's Health, and is one of the founders of ID Care, a local and very well-known and respected infectious disease medical practice. Rounding out our panel is Lori Stampone. Lori is a registered nurse, a certified dementia practitioner, and she also is certified as an assisting living administrator. Lori has 8 years of experience working as a nursing director at the assisted living level of care, and currently serves as the resident care director at Arbor Terrace of Morris Plains. Sending out a big welcome to all of our panelists today. Let's get started. We're gonna kick things off with you, Dr. McManus. We're wondering, what message do you want the general public to know about the vaccines that perhaps we in attendance today can help you spread to those who might be reluctant to get vaccinated?
Thanks very much for that introduction. Well, first off, I think that the vaccine is very safe. There's 3 options, all of them have been well tested. To date, 500 million people in the world have received the vaccine. In the United States, about 150 million people have received it. And in New Jersey, we have had about 4.3 million doses given. And all very safe. You can imagine that if there was significant side effects or complications, we'd all be aware of them. So again, the vaccine is very safe. It's still quite a challenge, and we really feel for everyone who struggled with the websites and the access points. Within the next 3 or 4 weeks, we're going to see a great deal of increase in the availability of the vaccine, and we're counting on the state government to structure it so that we can all receive a dose, but there is going to be a dose for everybody who needs it. I think that just like we wouldn't think of driving a car without our seatbelt on or riding a bicycle without a helmet on, we really ought to be thinking about not engaging ourselves in trying to live a normal life until we've had vaccination, because that is part of the pathway to back to normal life. We're still going to have to wear masks and protection, and think about the strategies because of the variants. But the other part of the concept is to think of, we're really in a race versus the variants, because the variants are probably the reason why we're starting to see an increase in number of cases. In New Jersey today, we're seeing about 4,000 new cases a day. And about 4 weeks ago, that number was about 2,500. So there's been a significant bump up. And I think that we're at the beginning of a surge that's crossing the country, beginning in the New York metropolitan area going forward.
Wow, thank you. And Dr. Williams, was there anything you'd like to add about messages that we can help spread to the general public about the vaccine?
Dr. McManus pointed out how safe the vaccine was, but, and I think he did allude to how efficacious it was. And I would just like to just power that home a little bit more. It is all three vaccines are very efficacious. You look at the efficacy, preventing illness, 95% in both the Moderna and Pfizer vaccines. And then if you look at J&J, it may not be as efficacious to prevent symptomatic COVID, but it does. All three vaccines have one thing in common. They do prevent you from being hospitalized from a severe infection from COVID, and even as far as death. So I think those kind of supplement the safety part of it. Just a very safe and efficacious vaccine.
Mm-hmm. Thank you. Thank you. And Lori, I want to bring you into the conversation as well. Can you give us an idea of how the vaccine rollout has gone at Arbor Terrace? Have you received any feedback or resistance from folks? Can you give us an update?
Sure. Hi, Trish, and thank you too for that introduction. I'm very pleased to be here today. So luckily here at Arbor Terrace, we had a great support system with our corporate team to make sure that we got vaccines here in the building fairly quickly, partnering with Walgreens. We had an excellent rollout with only initially 3 residents who did not want to receive the vaccine. And since that initial rollout about 2 months ago, we've had all but one of those residents now decide they would like to get the vaccine. Our greatest challenge was definitely with our staff. This is something very new. We have a lot of fears, and the cultural background of staff in this type of environment also played a role in some of the pushback. Luckily, we were able to provide a lot of education in various different languages, I might add, where we were able to really reach out and speak to those staff. A lot of education and ongoing education. At this time, we had more than half of our staff who did get vaccinated. And we had a few more people the second round come on because they saw, as the physicians have said, it was safe. We were okay. We had some minimal side effects, only maybe about 4 or 5 staff that needed to not come to work for a couple of days or so because of the vaccine. And now currently Arbor has joined, I feel one of the greatest decision-making is to be a mandated building. So we have now moved to mandating vaccinations in our building. And I felt with the education we provided and the support, the staff is very amenable, and we're looking forward to a really great success with that and having everyone here at Arbor completely vaccinated.
That's terrific. I know one of my employees was nervous about getting the vaccine and was looking to make sure none of us grew tails before she signed up for her vaccine. So yeah. Glad to hear it's been going pretty well. Dr. Williams, I was wondering if you could comment on the immunity the vaccine provides. How long does immunity generally last? Do you think we'll need booster shots if our immunity wears off, or we'll need booster shots to address the variants?
Well, we don't really know exactly the answer to that question. It is an RNA virus, and so probably what we will experience are mutations. As Dr. McManus has alluded to, we're already starting to see variants. These are mutations within the same virus, and we're starting to see variations amongst that. We may have to have boosters at some point. I think it's still a little early to know for sure. I think one of the kind of the nice things about the messenger RNA vaccines is that they're very capable of making a new vaccine that's capable of covering a variant or a mutation very quickly, and to get that out and to get that available for people to be vaccinated for. So I think we don't really know the answer for how long we will have protection from that. It may be a long time. But we just don't know the answer to that. I think we're very early in the process. I think right now we can say pretty safely that it's definitely 90 days. It's probably going to be much longer than that. I think we're seeing people that have had native infection that are still have antibodies and protection from the prior infection. So I think we're still early in this process. It will depend on how much the virus does mutate, and that will really depend on us getting vaccinated and keeping the viral burden down. The lower the viral burden you see, the less mutations you're going to see, and the less ability for us to actually have to be revaccinated. So the more the world gets vaccinated, the better.
Right. So it sounds like a little bit of a race against time.
Correct.
The more people who get vaccinated quicker, the less of the chance that the virus will have the opportunity to mutate. Would you say that's right?
Correct.
Yes.
Yeah, and, and these, again, like I'd say, these are RNA viruses. They are prone to mutate. And they don't have a check and balance that kind of corrects those mutations. So they just kind of mutate, and then they see if they live. And if they become the dominant species, which they could in that particular virus, then that can be the new vaccine variant that we may see. And I think that's really the goal, is to keep the viral burden down so that we don't experience those as frequently.
Right. Well, thank you. Thank you. And Dr. McManus, can you help us to understand, if we're vaccinated, why do we still have to wear masks?
Well, I think that really comes down to how vaccines work. Vaccines work because they prepare your immune system to protect you from the virus. So you can still get exposed to the virus, briefly have it before your immune system clears it and protects you. And we think that there's probably some risk that you could briefly carry it to other people and spread it, even if you've had the vaccine. We know that, for example, out in Washington State, there's been about 1.2 million people vaccinated, and of that group, there have been about 100 people who've developed the virus infection despite being vaccinated. That's 0.01% of the population, and we don't know how to predict who that's going to be. So if you're going to get the vaccine, we're not sure how well it's going to work in each individual. So I think that we're probably looking at wearing our masks for the remainder of this year. I think, unfortunately, we're still quite far from the goal line in terms of winning the game against this virus, but we will succeed. We're not going to give up the ball. We're going to keep moving forward. And as you mentioned, the main battle here is the speed at which we can get enough people vaccinated to break the transmission. You may or may not follow a concept called the R value that's reported every day in the state. The R value is, for every case we find, how many secondary cases there are. And our goal is to get that number under 1. It's been over 1 for the past 6 weeks. It was under 1 for quite a bit of time last fall, and we hope to get it back there again, but we need to get that number down. And we're probably going to have some resistance to opening the economy until that number is safely under 1.
Well, I guess looking on the bright side, then, at least masks have now become a fashion statement, right? They come in all sorts of designs. The next question is about how assisted living facilities like Arbor Terrace and skilled nursing facilities like Care One are currently managing the masking requirement, not just for their staff, but also for the residents. So Lori, I'd like to start with you to see how things are going at Arbor Terrace with masking.
Thank you. Masking is going well. I think I probably say, please put your mask over your nose more than 500 times in one day. And that goes the gamut between staff and residents, and now with some families coming in. Of course, initially there was challenges with supply, but thankfully now we no longer have those challenges. So we have a great amount of supply here, and we have a great process. When somebody walks in the front door as a staff, I should say, they are still screened, temperature taking, question asking, and then they're handed a fresh mask every day. So we have a great flow here to make sure that everyone has a mask. We have the ability to send out what we call here a voice friend or group messages to our families and to staff and residents. So we do regular reminders, don't forget your mask. And it's really just about everybody knowing that you have to wear a mask and going around and reminding people. The residents, I had one resident say to me today, I'm really done with this. And so that's completely understandable. It's a lot of reminders and making sure that we have the supplies available to make sure that people have what they need. But so far, like you said, Trish, it's now pretty much a fashion statement. And honestly, when people don't wear their mask, it's funny how many will be like, oh, I forgot my mask. So whoever thought we'd get there.
Right, that's terrific. And Dr. Williams, how are you directing the folks at the Care One facilities with regard to mask use for the staff and for their residents in the long-term care setting?
I mean, as far as, I think masking is masking is mandatory. Everybody's wearing masks and shields. And I think it depends on whether you're in a more high risk area, whether you're in a yellow zone, meaning a new admission or a contact to a person with COVID, or you're in a red zone where people have COVID, whether you wear the N95 or not. So I think if you're in those regions, we would recommend N95s in those regions, and then more just regular surgical masks or KN95s, whichever ones that people feel comfortable wearing in the other settings. But I think N95s people could wear at any point if they feel comfortable wearing those. And then surgical shields, wearing those. I think most everybody is doing that at all times when they're in the building and in patient care areas.
It amazes me how in a year we've all gotten used to that. Everybody is used to seeing all the shields and all of that. This next question is for all three of you, but I wanted to just kind of go one at a time. And I'm wondering what the current protocols are for COVID testing in hospitals for patients and staff, and the same for assisted livings and skilled nursing facilities. So we'll start with Dr. McManus. Can you help us understand how this is happening at hospitals? What are the testing protocols?
Well, the testing protocols are in the nursing home setting and assisted living are by regulation. The state has regulated that, and those change depending on how many cases are in the community. In the hospital, all patients being admitted and all patients undergoing elective procedures are being tested. The staff are only being tested to evaluate outbreaks. I think that you actually bring an opportunity up to talk about one of the key things in battling COVID is we just don't have enough rapid testing turnaround. I think that as well as wearing masks and social distancing and getting vaccinated, the third leg of that stool to keep it stable is rapid testing and identifying who has the virus. I think you probably might be aware that in New York, they recently came out with a passport for attending Madison Square Garden and Barclays and other facilities. And that's going to be judged based on whether you've been vaccinated, but also whether you've had a recent test that's negative. Okay. And I think that we really need a federal push, a state health department push to make those more accessible and easier to obtain. Some of the testing is very inexpensive, $2 or $3 a test for some of the antigen testing, and you get an answer in 15 minutes, just like a pregnancy test. And I think that would be very valuable for all of us to promote in terms of making the world safe and getting back to normal.
Great. And Dr. McManus, I'm sorry, I didn't mix that up. Dr. Williams, can you give us an update on your facilities?
As far as testing goes, I think
yes.
that is regulated right now, depending on the percent in the CL, the certain score for how many cases are known in the county. And so that's either once or twice a week for the staff. But I think that that's all kind of regulated based on that kind of strategy. But I agree that testing is, you can test your way out of a pandemic and out of an epidemic. Really, the more tests you do, you can never do enough tests. And I think that's been kind of our deficiency the entire time, is to be able to test. You can really do a lot of tests and you can really isolate. This is the people that have it, put them on quarantine or isolation or whatever you need to do. Testing is key to managing any kind of epidemic or pandemic. And I think that having more readily available tests, easier tests, are going to be key to, first of all, opening up society, but also really just in high risk areas like post-acute cares.
Mm-hmm. Yes, and Lori, can you give us an idea of how things are going with testing and what you're required to do at the assisted living level of care?
Absolutely. So as has been referred to, we do go by what's called the Cali score, which does generate a lot of regulation and guidelines and helps us to understand how much testing we need to do. Currently, we are doing PCR testing 1 day a week for every single staff member that comes here, with very strict guidelines that if you do not test and do your PCR, then you cannot come back to work until you have completed your PCR. We then have a second day of testing that we are rapid testing staff who have not been in the building within a certain amount of time. So that is our mandatory regulation right now, and that's the protocol that we follow. Residents do not have to be tested unless they become symptomatic. So therefore the resident, or if we unfortunately, I don't even want to say the words, got into an outbreak or had a positive test in the building, we would then have to test all the residents within a 24-hour period after the first positive. Luckily here at Arbor, we're happy to say, I think we're at 108 days COVID-free. So we are extremely excited about that. And we've had the ability to have a lot of rapid tests available to us, again, through our corporate partners and being able to, so everyone who comes into the building as a vendor, family member now who visits, for any reason to get past the concierge, you get rapid tested first. So we are really sticking to those guidelines, and we do feel, as the physicians have said, the testing protocol and being strict about it, I think has definitely helped keep our building COVID-free.
And that your discussion about family visits kind of dovetails really nicely with my next question. If you would tell us, how do assisted livings, how are they guided, or how do they decide when they can resume dinners in the dining room and family visits inside or outside? What guidelines are you held to for that?
Yep. So again, we are being followed by the CDC guidelines, any federal or executive orders in New Jersey, our local Department of Health. We just recently were able to open to indoor visits. And I won't bore you all with the different phases, but once you get to a point where your building has had no COVID positives for at least 14 days, at that point, we were able to open up to communal dining in pods. So that's where we stand right now. The dining room has to be socially distanced. Residents are generally sitting at a table by themselves. And that's what helps, CDC guidelines. Same thing with activities. We now function in pods where residents have been placed in their pod. They go with that group to dining. They go with that group to activities. And the purpose of the pod is to be able to have enough space for the residents to social distance and be able to be part of it. The only place you're not permitted to wear a mask is in the dining room. And of course, that is where there's all that social distancing. Our visitation and all of those activities are all directed by, again, the executive orders of the state of New Jersey, CDC, local health department. Indoor visitation just opened up. We just started last week. It is also a capacity level. So we do have to stagger how many people are here. We do rapid testing. It is in their apartments only for residents who are fully vaccinated. So the vaccine has now been implemented into some of the guidelines. If you are fully vaccinated as a resident, you're allowed to have a family member visit in your apartment, only in the apartment. They can't go anywhere else in the building. And during that time, we are asking to remain masked, but they can hug each other. So if you're fully vaccinated, you're allowed to touch the person. If a resident is in a shared apartment, then the visitation has to be in a common regulated area because of obviously 2 people in the apartment. If someone is unvaccinated, they can be in an area, a visitation could be in an area where we can regulate it because again, they are not permitted to come close to each other. We continue with, as we have for many months now, with outdoor visitation, all screening and testing being done prior, and again, your 6-foot distancing. What changes, again, is that Cali number, and if the county goes into a high level, we can be told by the state that we have to close down to visitation. And of course, any outbreak in the building would close us down to all of those, amenities, as we call them now, in assisted living.
And thank God the weather's starting to change because I think that'll be a big help to families.
Getting the weather. Well. And ironically, an interesting point I think is that when we opened the doors to indoor visitation, we really thought we were going to have lines of people out the zoo, and it didn't happen that way. We've got many families who have said, we're just not ready to come in. We're just not comfortable yet. I want to be fully vaccinated. So although we have a steady flow, it's not at the level that we thought it was going to be.
Right. That's great. And Dr. Williams, are long-term care facilities like those at Care One, are they required to follow the same requirements as the assisted livings?
There's a little bit of a difference in the long-term versus the assisted living, but as a general rule, they're virtually the same. So there are some nuances that are different as far as testing goes. They have more outbreaks. They have more people in red zones. I think those tend to be more of a kind of a nuance, but there is probably more testing that goes on in a skilled nursing and long-term care facility than does in assisted living.
Can you, while I have you, can you tell me, do long-term care facilities have the ability to decide whether or not they want to accept a new resident who's COVID positive? Or are they required to accept? Are not allowed to discriminate in that way?
I don't know that I think that most people are okay. I feel comfortable taking care of people that have COVID. We all have had experience at all the sites that I go to have experience taking care of people that have COVID and that are either recovering from COVID or actually actively have COVID and in the early phases and are not very symptomatic. I think at some of the sites we've given monoclonal antibody for those that have been recently diagnosed, and they've been able to get it within a 3-day period, which is a very, very effective therapy if given very early. And I think that most people have a level of comfortability over taking care of people that have active COVID, as long as they don't require significant interventions like high dose oxygen and things like that, because most of the therapies they can do at those sites. There are some therapies that we cannot do that have to be done at the hospital. But as a general rule, if you're early in the diagnosis, I think most people feel very comfortable giving people the monoclonal antibody, BAM, and then now it's going to be a combination antibody. Feel very comfortable giving that at their site. So I don't think that they're also uncomfortable taking those patients because they're very comfortable taking care of them in the first place. Mm-hmm. So I think most people at this point, having lived with this for a year and being able to get better at taking care of these patients, better at PPE, better at being able to contain them in your own facility, better at being able to manage that and actually have certain kinds of zones where you have specific zones where people are. I think most people feel very comfortable taking care of these patients.
And I'm assuming too, the fact that so many staff have had the vaccine. I know that's made me a little more bold in my life, knowing that I have the vaccine. I'm a little less afraid of getting sick myself. So
there could be more.
Yes,
I think the average is lower than we'd like it to be.
Yeah.
Mm-hmm. And Dr. McManus, I noticed as a geriatric care manager with clients who are in the hospital, hospitals seem to have gotten a little looser with their requirements as far as having visitors come in. Can you give us an idea of how things are working in your hospital system?
Well, I think that most of the rules are basically guidelines, and depending on the situation, it's good to individualize it. I think, when a year ago, when we had 8,000 people in hospitals in New Jersey, it was very hard to individualize any care. Now, the numbers in New Jersey are around 2,000 patients hospitalized, 2,200 hospitalized. And I think that it can give the hospitals a chance to personalize the experience for people. I think that in the year we've learned how important connection to other people and family members is to just all of your health, not just mental health, but your whole physical health, and how important that is. So I think that if you are in a situation where a family member is in the hospital, communicating with the nursing staff and the physician staff, and expressing what you want to happen and an opportunity, I think there's always a chance for them to make an exception or to modify their guidelines to individualize it.
Mm-hmm. And I'm sorry, go ahead.
I was going to say that's been my experience both in the Atlantic Health System and at St. Clair System. All the hospitals in the Morris County area really have taken that as a very important factor in getting somebody well.
Right. And while I have you, I have my last question here, and then we're going to go to the Q&A, is not to minimize any of the panelists, not to minimize at all what we have been through as a country, as a world, and certainly as medical folks over this past year. But looking back, is there a recognized positive or a silver lining or one good thing that you can say came out of this experience for you?
For me personally, well, I think that it certainly gives you time to reflect on what you value and what's important in your life, and that's relationships. And how key it is to reach out to your family and friends, even if you can't personally be present with them, to stay in touch with them, mm-hmm. And have good lines of communication.
Right. Thank you for sharing that. And Lori, how about you? Any silver linings?
Yeah, Trish, there actually were a few here, especially in the assisted living environment. So first of all, we learned how to adapt and work as a team very quickly. we were in an ever-changing moment by moment, and we all did that with really fear as the underlying foundation initially. You know, fear of would we get sick, fear of would we give it to a resident, fear of watching residents pass away that, you know, had COVID or go to the hospital. So the ability to adapt was a silver lining, the ability to come together as a team, the relationships we built with our families who had now put their complete 100% trust in us because they no longer had the ability to be here and be part of their day to day. So certainly learning and just learning how to redo, you know, you can function in many different ways, learning how to Zoom residents within each other's apartments and keeping them connected, and how are we going to make this work? So really that's been a silver lining. And from the nursing perspective, hey, if we wash our hands and wear masks, we won't get the flu. So that's not too, you know, well, so we're, like, you know, very happy because we had no flu this year. So
Right. Lessons learned.
Infection control really does make a difference.
Right. Thank you. And Dr. Williams, how about you? Any silver linings?
So those were all great. I'm gonna pull it back to the science a little bit. I think that the RNA vaccines and some of this RNA technology may have revolutionized how we look at vaccines now. And I think that it may change the way we vaccinate in the future. So I think that if there is a silver lining, that might be something that's very important in how we react to certain illnesses in the future.
Yeah.
Mm-hmm. Right.
Even our own existing ones.
Exactly. Thank you. Well, I'm in the Q&A now. And we have a question from Alex. I can't see the whole last name, but Alex would like to know from the panel, at what point do you anticipate testing will no longer be required for those who are fully vaccinated? I'm going to throw that out to, you know, either Dr. Williams or Dr. McManus, or both. Who would like to go first?
So I'll start with that. So you know, I think that right now we have vaccines that provide about 95% efficaciousness, meaning that it's effective in preventing disease. If they're not 100%, people can get disease. I think if you look at J&J, it's around 72% for people in the US. And so people still can get disease. And I think people, if you get symptomatic, I think that would be an indication to get tested in that setting. Right now, I also think that we don't know if people are asymptomatic carriers. And I think if you were exposed to somebody, that might be an indication to maybe get a test as well. If you're just looking outpatient, if you're looking at more of the inpatient side, meaning in like a post-acute care setting, I think we're doing that mostly to prevent asymptomatic carriers because we don't really know how effective the vaccines are yet at preventing asymptomatic carriage. We think they're very effective. All the data coming back are showing that there's decreased carrier rates if you get one of the messenger RNA vaccines, decreased carrier rates. The numbers we just don't have locked down yet, and I think we will have that at some point. But right now, I still think that probably testing is still with there being such a high viral burden. And if you become symptomatic, I think that's probably a good indication to get it, because they are not 100%. You still can get disease. You can still get a kind of a low level burden disease, but you can still get and still be able to transmit it to others who are unvaccinated. And I think that's important. And those that are at risk around you, you could also transmit, whether they're an immunocompromised person or somebody like that. I think those are important reasons why we should still vaccinate, be able to test the vaccinated. It doesn't mean you're 100% safe.
Okay, thank you. And actually, Dr. McManus, I have a different question for you. Nora is asking this question. So if the variants are spreading so effectively in New Jersey, where so many people wear masks, and there are restrictions on who we can meet with and where we can go, what do you foresee happening in those parts of the country where people don't wear masks and there are no restrictions? I'm sure Nora's thinking of, maybe Miami, for instance, but there are other areas too.
Well, it is quite extraordinary that you look across the country and you see very little difference in the long run in different areas that were rigid with masks and less rigid with masks. So, for example, Florida, is having less cases than we are right now. In fact, New Jersey is #1 in the country as a state for number of cases per capita. And so there's a lot of factors involved there. It's how effective we're doing with getting the vaccine out. And even though we have a mandate and we ask people to wear a mask, not everybody is. And it's usually when people let their guard down. I think that one of the side effects of having the vaccine roll out is people feel safer. And unfortunately, the virus doesn't react like we don't just push a button and everything is fine. It's not like push the science button and we'll all be okay. This is a very, very slow evolving process. We're probably 4 months away from being at 75% or what we think may be herd immunity, but we may get there and we may have to get to 90%. This is all, a lot of this is speculative. And that's why Dr. Walensky, the CDC director, was so upset and had this feeling of doom, because you can see, you can visualize on some of the charting and logistics and forecasting that we're going to see more cases, even though we have vaccine here, and that's a bit of a tragedy that cases are occurring and people could have been vaccinated and their severity of illness could have been attenuated.
Right. And Nora also wanted to know, as a vaccinated person, would you personally feel comfortable taking a plane flight for non-essential reasons right now?
I think that traveling by plane is very, very safe if you wear a mask, even if you've been vaccinated. And that means you don't eat on the plane or drink. Drink before you get on the plane. I think that when you see all these stipulations about trying to reduce travel, it's not because of the travel, it's what we do when we get to those other places. When we travel to other places, we tend to go for events and activities, and we tend to be more social. And that's the real risk of travel. So that's really why, even though New Jersey is the most dangerous state in the country right now, we are restricting people who travel, because when you travel, you take your mask off and you socialize with your family and friends and other people, and you go out to dinner. And those are the activities that are at risk. The actual plane flight is very, very safe.
Mm-hmm. I recently had an employee who went to Florida, and we looked up the CDC guidelines for what she needed to do when she came back. And she's vaccinated, and I was surprised to see that she's still required to quarantine for 7 days. She can get tested. Even if it's negative, the CDC is requiring that she continue a 7-day quarantine. And I've been a frequent caller of the New Jersey Poison Control hotline, which is also the COVID-19 hotline right now. And I called to inquire about that. And they said that it's because of variants, geographic variants, that they want to make sure that even though you're vaccinated, you're not going to be bringing other variants and exposing people in New Jersey to what might be happening elsewhere.
Right. So if you look at New Jersey, our predominant variant is the UK variant, which is the B117, which is our predominant variant. It's pretty susceptible to the vaccine, pretty susceptible also to the monoclonal antibody. But if you go to some place like Florida or Texas, you're running into situations where they're more at risk for things like the Brazilian variant or the South African. And I think bringing those back is a concern, because those tend to be a little more resistant to the vaccine, even though still effective, tend to be generally resistant to the monoclonal antibody. And I think that's a scenario that we do not want, is to have some of these variants that are resistant, more resistant to the vaccine, more resistant to our current therapies that we have, that are going to be more problematic for us in New Jersey. If we can just have the UK variant and that be our variant, then that would be great for us. So I think that's part of the reason why they recommend, if you travel, come back, you need to be tested.
Right. Great. And one last question in our Q&A here, and it's by an anonymous attendee. It's basically a question about what do we know about any long-term effects of these vaccines?
Well, we don't know a lot about long-term effects because we haven't had enough time. But let's think about other vaccines. In general, when people have adverse effects from vaccines, they occur within 6 weeks. You know, children get 59 vaccines in their young life. And, you know, we've had a dismissal of the concern about autism for some of the vaccines, but there really have not been long-term effects from vaccines in any experience. So it would be a new side effect or new complication if it were to occur. And, you know, as I mentioned when we opened, 500 million people have been vaccinated in the world. There's only 7 billion people, so that's a significant proportion already. In the United States, there's been 130 billion doses given. That's a lot of doses given. So we'll all be in the same boat together. And I just want to take a moment to applaud Lori for her efforts on making the vaccination mandatory in the facility and joining the Rutgers University.
Yes.
It's amazing to me that we can require people to get vaccinated to study a book, but we don't have to require them to get vaccinated to take care of the people we care about who are vulnerable. But I do think that's going to come. It's just a matter of time, just like the flu vaccine became mandatory. So thank you for being a leader, because we need more of that kind of activity and behavior to step up and take some responsibility and make the environment safer. And also just a brief plug for one of our sponsors. You know, one of the things that really has happened here, it should make everybody more attentive to having power of attorneys and POLTs and different advanced directives for their care, so that there is somebody who can help, particularly in the nursing home and assisted living setting. There's a great value in that, and I think this is kind of demonstrated this pandemic. And so people should be online to get those things addressed, even as the pandemic is settling down.
Well, I'd like to thank all three of you for taking the time to share all this valuable information with us and to answer so many questions. I'm going to turn things back over to Wendy now.
This was fantastic. Thank you so much, Trish. You did a great job moderating. And Dr. McManus, Dr. Williams, and Lori, you guys all taking time out of your day today. We really appreciate that. Great information. I like to go to the science. I'm a believer in that. I'm also understand that nothing's perfect.